The Dr. Terri Show is presented by Evexias Health Solutions. Evexias Health Solutions is an emerging leader in the integrative medicine on a mission to positively impact people's lives through the transformation of healthcare. Evexias educates and trains practitioners on the new, innovative, integrative therapies that support a preventative care model that drives vitality as you age. You can learn more about Evexias Health Solutions and many of the healthcare topics we discuss on the Dr. Terri Show at Evexias.com. That's Evexias.com, as well as find a provider near you. Now here's today's episode. Welcome back to the Dr. Terri Show. So today I'm going to dispel some myths and confusion with somebody that's been on before, Elizabeth DiMeo. She's a clinical nutritionist, and we're going to talk about what's a supplement, what's a good supplement, what's a nutraceutical, what does that even mean? What about probiotics? How do we find a good one? How do we know what means it's, a good supplement over the counter? So join us today in the conversation as we talk about supplements and probiotics. Okay, welcome back, Elizabeth. So thank you. Happy to have you back. So we opened a couple of cans of worms last time that there's been generated a lot of conversation around. And, we were talking about seed oils and inflammation, and, kind of how to avoid them, and what are some, small things and just changes we can make, and even what's in our pantry. And I want to continue that conversation. If, so many people are looking for ways to be healthier, especially after COVID, when it was glaringly obvious that the majority of people dying from COVID had diseases like diabetes or heart disease. And so it really kind of woke us up, I think globally, really, but especially in this country. And people are looking for ways to be healthy, but it's hard to find because we're so marketed to. Another problem is that when many people go and ask their healthcare providers about it, they don't even know how to guide them, because as many of the doctors and other clinicians that I work with, we're just not taught about nutrition or supplements in school. So we just don't have a good knowledge base. We have to go seek that knowledge other places with, advanced education, or going to seminars, or, going to some sort of, workshops on these things. So I just want to continue the conversation around, what should we have in our pantry? What supplements should we be taking? There's, when I was introducing you on the last show, you have such an amazing background as a clinical nutritionist, but your specialty, what you're really passionate about, is nutraceuticals. And what is a nutraceutical? Is that different from a supplement? So let's just kind of start right there. What is the difference between a nutraceutical and just your general supplement that you would buy over the counter? And can you even get nutraceuticals over the counter? Let's talk about that.
So it is an interesting conversation, Terri. I mean, I think there is a definition for a nutraceutical. Technically, it's beyond the diet before drugs.
Oh, I love that.
Technically can reduce the risk for chronic disease. Now, that's hard to say on paper,
right?
But you can verbally say that, and say that by taking certain nutraceuticals, they have sort of a prescriptive capacity.
Right. So I've actually read studies that even say that we're seeing that certain nutrients, certain nutraceuticals actually can help mitigate certain diseases. And in some papers, I read about diindolylmethane and how they're saying that's a nutraceutical that alongside chemotherapy in women with breast cancer had better outcomes. Right. Things like that.
Right. As we know, diindolylmethane, or DIM, can help shunt estrogen metabolism down the 2-hydroxy pathway,
right,
which is the more beneficial estrogen.
Right.
I mean, not all estrogens are bad, but there's so many pathophysiological factors happening in the body.
What we're doing with it in the gut, how we're metabolizing it, and so forth.
And then, of course, we think about all the environmental estrogens, and we can see why there's just a greater risk for hormone-related cancers.
Right.
But when we think about nutraceuticals, we want to think about it in the capacity that when a provider has the knowledge to prescribe a nutraceutical with a same prescriptive fashion that he would or she would a prescription drug, that the outcome would be to significantly support the physiology.
Right.
So, for example, if you're saying to a patient, hey, just go out and get a vitamin D supplement, your D is low. Well, do we have reproducible results? Do we know if that patient is actually going to get their vitamin D
up? Or going to absorb it.
Or is going to absorb it, because in all of the research and most of the provider-based supplements that a lot of providers are using or practitioners are using. For example, if they're going to give vitamin D, they're going to give it with vitamin K, MK7 to be specific, but it's the K that actually gets the calcium out of the blood and into the bone.
Right.
So if you just go to buy a vitamin D supplement, it might not do, it might raise your vitamin D, but it might not be very effective for bone loss, osteopenia, osteoporosis. So there's where we lose the connection. So supplements might supplement a good diet, but Nutras might be more focused with that prescriptive capacity so that we know what we're looking for, just like a provider would prescribe a pharmaceutical.
Right. So with, supplements, you're explaining that nutraceuticals and supplements are a little different, because a nutraceutical, it sounds like it's more specific, it's more focused to address a problem, rather than I'm just going to get a multivitamin and, throw a bunch of darts at the dartboard and hope something sticks kind of thing. Is that kind of what you're talking about?
A little bit. I mean, I think that the word vitamin, mineral, and supplement and nutra could all be sort of flushed together, if you will, because a nutra might be the same as a supplement if you're, say, getting a vitamin D supplement. But if we use the word nutraceutical within a clinical setting, especially using third-party tested nutraceuticals or supplements, where there are governing bodies looking at the ingredients, looking at the manufacturing, looking at the final product, and making sure that it's doing what it says it's going to do, then that gives us the idea that if the provider is going to use that supplement like he or she would a pharmaceutical, that they're going to try to get that reproducible result. Now, I don't throw the baby out with the bathwater and say, hey, every over-the-counter supplement is bad, and it has to be a Nutra and not a supplement.
Right.
But the idea is, if we know enough about nutraceuticals impacting the physiology, then we are hoping that when we take them, and 74% of Americans, based on a recent survey, are taking supplements, 86 to 92% are deficient in some of the main nutrients. We know that we need them. And you made a good point about COVID. Most people were realizing, because from a metabolic standpoint, during COVID, less than 12% of Americans were metabolically healthy. That's based on NHANES data. And then you look at now in 2023, 2022, less than 7% of Americans are metabolically healthy. So what does that mean? Inflammation, lack of nutrition, comorbidities.
Right.
So if you're going to go to the store and you're going to buy something, certainly you want to support your immune system because it was a virus. So what are you going to look for? D, vitamin C, selenium, zinc, vitamin E. So things that can support the physiology from a viral standpoint or infection standpoint.
Yeah, you've said a couple of things I just want to get clarity on. So I know what physiology means, but when you're speaking in these terms, just for our audience, when you are talking about support the physiology, break that down.
So I'm glad you asked that question, because this has been my focus in my nutrition experience since many moons ago when I got into this business. If we really dig deep, you have cells make tissues make organs, and organs make organ systems. So you can't have a brain as an organ, the liver as an organ, the heart as an organ, the kidney as an organ, without its tissues and without its cells.
Right.
So all of the cells, how many trillion cells you have that make up all of the body tissues, is part of your physiology.
Right.
And that all works chemically together. So everything is relying on other things. And your nutrition, when you put food in your mouth, you are extracting nutrients, vitamins and minerals, hopefully to support that physiology, cells, tissues, organs, and organ systems, so that everything is running like a well-run car.
Yeah.
You mentioned yesterday about the whole car analogy, where you can have the most beautiful car in the world, but if you don't handle it like that beautiful car,
Right.
if you don't put the things in it that it needs, the antifreeze, the oil.
Change the oil, yeah.
And I don't know what cars need,
Yeah.
pistons, things, I don't know. But at the end of the day.
Well, we pay a lot of money for somebody to know about that.
Right. So for me, it's you use nutraceuticals like a pharmaceutical to get some kind of reproducible result in a prescriptive fashion. It doesn't mean you can't go and buy an OTC supplement that doesn't work and isn't good.
Right.
It's just that we want to make sure that when we are taking supplements, they are quality supplements
Right.
that have been third-party tested.
Well, and that brings another point. You said something earlier about 70+% of Americans are buying supplements. They're doing it for a reason. They're either looking to feel better or they're afraid about getting sick, especially since COVID. I had a guy, in our clinic. We primarily, do hormones, as everyone knows, but obviously there's a lot of things that come with that. So, and most everybody comes into our office with fatigue, not sleeping, brain fog, brain not working, all the things that could be hormonally based, but also inflammatory based. But this is a big trucker guy. He's probably not eating the best diet in the world because he's on the road, but he even brought in a giant grocery bag full of supplements. I mean, he probably had about 20 different supplements. And because he was looking for energy, he was looking for something to fix these problems that he was experiencing. And after we talked, I said, I can take this down to about 5 that you really need. So we kind of went through them all. But with the nutraceutical, one of the things you talked about is how some of them work together, and we might be just taking vitamin D by itself, but we need vitamin A and vitamin K2 and also magnesium really to really do all the work that it needs to do. You need vitamin D raises calcium. Vitamin K2 puts it in the bones and the teeth where it belongs, and vitamin A gets the extra out of the kidneys. So they all work really well together. And to me, that's kind of what you're saying about a nutraceutical is using it in a prescriptive way. Maybe we're using a vitamin D to increase bone, but if you're not looking at all the minerals you might be deficient in, what good is the vitamin D, going to do for you? So,
it's a good point, by the way. I do want to make that point because I think really you're driving home the message that it's the synergistic element that is creating the dynamic that is changing the physiology. So if you think about a B vitamin supplement, you don't just want to take B12 because B vitamins as water-soluble vitamins all work synergistically, and they're all part of the Krebs cycle, which is your energy cycle. Right. And if you want to take it a step further and talk about methylated Bs.
I just got stressed. You said Krebs, and it just got PTSD.
Yeah, you got that
from don't talk about the Krebs cycle.
Back in the day. But if you look at all those Krebs cycle nutrients, it's B1, B6, biotin, all B12. And now we're taking it a step further, and we're talking about that prescriptive nutraceutical. And are we going to say, hey, that prescriptive nutraceutical might be a methylated B that is going to give us those nutrients to help support methylation, especially from methionine to cysteine to glutathione, which is your master antioxidant. But you might stop at homocysteine, and if you do, maybe you don't have enough of methyl Bs. That's when the Nutra comes in, versus you just go to the store, you buy a supplement, it's a B12, maybe it'll give you a little bit of energy. It's made cyanocobalamin rather than methylcobalamin, but it might not have that same breadth and robustness in terms of altering the physiology.
Right, because what I think a recent study has said up to 40% Americans have a genetic variability in their ability to methylate, and methylation is a huge part of detoxification. It's a huge part of breaking down and metabolizing hormones, and any toxin that we put in on our body, breathe into our body. Methylation is a key part, and so many people don't methylate well, and so you make a good point. The difference between just a Costco B supplement that might have all of them might help you a little bit, but what if you're deficient? What if you're not a methylator? How's that gonna help you? So I love the direction of that conversation. So nutraceuticals versus supplements. Now, one of the questions I get all the time is, how do I know if it's a good supplement? Like how, you go to a vitamin shop or a Costco or just anywhere, and there's just rows and rows. There's probably 10 different brands of just vitamin D alone or vitamin C. Like, how can someone shop you said you didn't want to throw the baby out with the bathwater, but how do we know what's a good, without promoting a brand, which I don't even know, but I get asked this question a lot.
It's a sticky subject, and I think the main thing with over-the-counter supplements is that there's technically no governing body regulating. There are laws in place under the DeNeui Act. There are laws in place that say if you are going to make a supplement, you have to follow these rules. And the ingredient is tested and the product is tested to make sure it's, quote, efficacious, meaning it's healthy enough for a human to consume.
It has what it says on the bottle that
exactly.
It has in it.
I mean, there are some supplements that have been found to have, plant dust in them, and they're molds or beetles or whatever it is. And the problem with the DeNeui Act is that, yes, there's some regulation around the supplement, but they're not regulating from the standpoint that every supplement that is on the shelf, whether it's at a Walgreens or a CVS or a Target or whatever it is, or the grocery store or Whole Foods, is being tested once it's sitting on the shelf. Now, you hope that the manufacturer could be ABC Manufacturing Company that makes a B complex, but you'd hope that they are following those DeNeui rules, but they might not be.
Right.
And
there's no seal of
there's no seal of approval. Exactly. So we have that GMP, good manufacturing processes, that is technically a third party that most of these, quote, provider-based supplements have that stamp on them to determine that they have been evaluated for efficacy once the product is manufactured and sitting on the shelf.
So a lot of times a supplement or a nutraceutical, a supplement that can only be bought in a physician's office or a clinician's office, nutritionist's office, can't be found at the regular store. You would have more, you would feel more comfortable that is a third party tested, because that's why that clinician would be carrying that.
Right.
I know in our clinics and in the doctors that we train, that's all we have. The one other question that I get a lot of that I wanted to pick your brain on, we talked about the difference between Nutras. We talked about, how do you find good ones? How do you know? Because really it's, unless you're getting a baseline, cellular nutraceutical or, vitamin tests, like what's my vitamin D level? What's my magnesium? What's my, not red blood cells, but white blood cells, like really looking at what's happening. Unless you get a baseline and then start a supplement and get another one to see if you're absorbing it, like it's kind of hard to know. So you just kind of have to trust, I guess, your healthcare provider to provide a good, solid nutraceutical. Now, I always know, because we test vitamin D levels on all of our patients. So, I can always tell if a patient has a vitamin D level over 40, they're on a supplement, because that's just not a normal level anymore.
Right.
We're out in the sun, we're putting on sunscreen. But one other question, because we've talked about gut, we've talked about gut health, and, probiotics are a big craze. But the other question I always get is, how do I know what's a good probiotic? A lot of people think it has to be refrigerated to be a good probiotic, and then there's some that are just over the counter. So what's just your down and dirty rules around, how do I know if it's a good probiotic?
So, that sort of physiology around the microbiome, which is the collection of protozoa, yeast, fungi, bacteria, is that we have more bacteria in our gut than we have cells in our body. And those bacteria have specific strains, there's specific types, and they have an affinity for specific areas in the gut, and they actually have certain roles. So if you look at Lactobacillus acidophilus, it's primarily in the upper GI. Bifidobacterium is largely in the lower GI or the colon. And so they have their specific roles. And so if you're going to, and those are what's most populated in the gut, but if you're going to any OTC supplement because you feel you need to take a probiotic, you certainly want to make sure that you see Lactobacillus acidophilus, Bifidobacterium, but then there are other strains that might be more focused for immune function or lowering inflammation. And that's where you really need a provider to sort of guide you. There are strain-specific. Culturelle is a strain-specific over-the-counter supplement that when people started taking it felt better, but that's because we're so deficient in good bacteria in the gut, which is why we're seeing so much IBS, irritable bowel syndrome, constipation, diarrhea, IBD, irritable bowel disease, Crohn's and colitis. Or GERD, which is to me, just a problem of poor gut function and the type of foods we're eating, causing everything to sort of come up and not go out, especially if you're constipated.
Right.
So I think for me, probably most people need to be on a probiotic. So if they go to the store and they find something that has a varying amount of specific strains, then they can maybe be guaranteed having some variety.
A broad variety.
Right.
Yeah. So, but if it's got 2 or 3,
maybe 2 or 3, and you want to see probably about somewhere between at least 50 billion total.
That was my next question.
Yeah.
You see
CFUs.
20, 50, 100 billion. What does that even mean? So at least a 50 billion.
At least a 50 billion for most people that are coming in with some kind of GI disorder. But if you've been taking probiotics, a probiotic or a nutraceutical from a provider, then you're going to get very strain specific.
Right.
For example, Lactobacillus acidophilus NCFM, North Carolina Food Management Chain. This is a specific chain of Lactobacillus acidophilus that when you consume it orally, it actually withstands stomach acid so that you can consume it and it populates the gut.
Yeah,
if you don't see that, then there you have it.
If you don't see NCFM, it might not survive down to get into the lower gut where to do its work. Okay, that's awesome. Another another rule of thumb that I've had patients. I'd love to pick your brain about this before we wrap up. But I've had patients, start on a Nutra probiotic, a probiotic that I may have given them, like, oh, I had to stop taking that probiotic because it made me so bloated and so gassy, but I'm like, but that's a good thing because it's killing off the bad bacteria. You'll get through that. So talk a little bit about that, because that doesn't mean necessarily that they didn't need it. In my mind, it means they really needed it.
Right. So that takes us a little bit back to the idea of provider-based nutraceuticals, because if you are a provider that is stool testing, you can look at what's going on in the gut via the stool.
Right.
And that gives us a map of what the patient might be deficient in some of the most prominent bacteria that support gut health, gut function. So if you go and take a probiotic and you get bloating and you get gas, it's largely because you're probably so deficient.
Correct.
That when you take that nutraceutical or supplement or probiotic on the over the counter, it's just putting all that stuff into your gut. And if you're eating any kind of vegetables, the probiotics like to kind of eat those vegetables, which also produce more gas and bloating. So, but if you're not eating vegetables and you just have what they called a dysbiotic gut, where you have an imbalance of good bacteria, your bacteria is going to be actually unhappy. So it might be that you actually have to clean yourself out a little bit before you go and you put some of these specific types of strains in the gut.
Start low, go slow.
Start low, go slow, be on an elimination.
Right. And maybe even that might be somebody that starts on a probiotic that maybe only has 2 strains.
Right.
And just really kind of prime the pump, if you will, because as those bad bacteria die off because the good bacteria are eating them, they release these gases and make you feel really bloated. Well, I hope that you got some questions answered about nutraceuticals and supplements and probiotics, and then we didn't even talk about prebiotics.
I know, I was
which
just
is
going to
really
say
important because
that's a big one.
Yeah, we have to feed those good bacteria with prebiotics, which really should just be fiber. But we have more to talk about. So thanks for joining us again.
Thank you very much. It was really great to be here. Appreciate it.